Welcome to the Family Voices of California Brown Bag Lunch series. It's a training series on health and policy topics affecting children and youth with special health care needs, geared towards diverse stakeholder group, including families, youth professionals, parent staff, and even advocates. Just to give you a note about who Family Voices is, we're a locally based, nationally connected organization. We're a statewide collaborative of parent-run centers working to ensure quality health care for children and youth with special health care needs. We are a longtime chapter and soon-to-be state affiliate of National Family Voices, and we are California's federally funded family-to-family health information center, providing statewide support to families of children and youth with special health care needs. If you have any questions about who we are, you can visit our website listed right there. Just to give you a few notes about using today's technology, if you have a headset and a microphone, then you can easily speak through your computer to ask questions out loud. If you don't have a headset, that's not a problem. You can either use your telephone or you can type in your questions. The call-in number for the telephone is in your confirmation email, or if you're connected on the audio menu, you just select Use Telephone, you enter the dial-in, access code, and audio PIN. If you're only listening through your computer speakers, then you're going to have to type in your questions. You won't be able to raise your hand in the same way. And if you have any problems, GoToWebinar is generally really good at helping you get online quickly. You can give them a call at this number. You can send me a chat or a question too. And generally, since we have a large group, everybody starts out on mute just because it's easier to hear. So again, asking questions. When the presenters indicate that it's time for questions, you can either use your voice as long as you have a headset or telephone. Select the little hand icon. That lets us know that you want to be unmuted, that you have a comment or a question. If you have any problems with that, you can always type them in on the questions page. The materials discussed in today's webinar will be up on our website by tomorrow. I will send you an email. You'll get an email from me telling you that they've gone up. All the materials will be available to you to print out, to peruse as you like, and a video of this webinar will also be available later if somebody you know missed it. With that, I want to introduce our topic for today, improving access to care for children with epilepsy, with Carrie and Bill. And with that, let me just make Carrie a presenter. One moment. And I want to thank you guys for being here with us. Okay, perfect.
Hi, it's Carrie. I'm just PowerPoint. Welcome. We're happy to be talking with all of you today, Bill and I. And I need to start by saying that this will be a really fast overview, and we will cover a lot of material. Both of us are happy to speak with you about any of the information we cover after this call. Please either call us or email us, and we will get back in touch with you. Today we are going to talk about a federally funded project that Bill and I and others have worked on over 2 different grants that we've worked on over the last 6 years. And we will then also talk, Bill will talk a little bit about epilepsy. What is epilepsy? What do you do if someone's having a seizure? And that will be covered fairly quickly. We then will talk about resources and materials that we've developed under these projects and how you can obtain those materials and resources. And then we'll also share a little bit with you about some of the lessons that we've learned and some of the things that we have tried in terms of improving access to care for children with epilepsy. And our most recent grant, we've really focused on improving access in rural and frontier communities. So you'll see some of the activities that we've done in those areas. Let me go to the next slide. Both of these grants were funded by HRSA, and they were grants that were focused on improving access to care for kids with epilepsy. There were 4 that were funded most recently, and those 4 grants are actually just wrapping up, and a new round of grants have been funded. And besides us, there were grants in New Hampshire, Vermont, Washington, and project in Florida and New York. Our first grant that was September '04 to March '08 was actually just here in California, and we expanded our reach in our second grant that we've had for the last 3 years, and we worked with partners in Nevada, Wyoming, Alaska, and rural California, working with University Centers for Excellence in Developmental Disabilities and family support organizations. We worked with Family Ties in Nevada on this most recent grant. The goals and objectives of the project, the overall goal was to improve access to healthcare and related services in the states that I've mentioned. And in California, our state team included Neva and Bill with Northern California Epilepsy Foundation affiliate, and then Kathy Smith here in the USED working with me, and others that actually have been involved in some of the work that we've done in California.
Okay, well, thank you very much, Carrie. My name is Bill Stack, and I was just going to give an overview of our affiliate and a little bit of information about epilepsy. So because this is a webinar and a little bit less interactive, please write down any questions you have and we can address them towards the end. But I work at the Northern California Epilepsy Foundation. We're one of 51 affiliates throughout the United States. There's 2 other affiliates in California, in Los Angeles and San Diego. And in Northern California, we provide a variety of different programs and services. We spend a lot of time over the phone providing information to newly diagnosed families or for people that already have epilepsy and have questions about health insurance or getting their driver's license back, or if there's any employment discrimination or challenges with getting medicines into schools. We provide some consultation for them. We also have a network of 10 support groups. We have a peer-to-peer program called Epilepsy Connection. We host conferences and community education events throughout our service territory, which spans from Fresno north to the Oregon border. And we have a variety of activities for kids. We have a camp for kids in Yosemite National Park. We have social excursion programs that we host throughout the year. And then we also have fundraising events such as our stroll and our gala, to mention a few things that we do. So I'm not sure what everyone's knowledge of epilepsy is, but we'll do a brief overview. Epilepsy is a neurological disorder characterized by the tendency to have recurrent seizures. And a seizure is a brief, temporary electrical disturbance in the brain. So a seizure is actually just a symptom of epilepsy. If a person gets hit in the head with a baseball and falls down and has a seizure, they do not have epilepsy. If 2 years later, they continue to have seizures, then they are defined as having epilepsy. So 1 in 10 people will have a seizure in their life, but only about 1 in 100 people have epilepsy. So nationally, that means 3 million Americans, 200,000 new cases are diagnosed each year. Although you can develop epilepsy at any time, 50% of people develop it before age 25, and the fastest growing segment of the population with epilepsy is actually the elderly, and we'll talk about that in the causes of epilepsy. So unfortunately for people with epilepsy, 70% of them have no idea why they've started to have seizures. The identifiable causes, the #1 cause is head trauma. There's also infections like meningitis and encephalitis that can cause damage that would result in seizures. If people have brain tumors and strokes, 1 in 6 people that have had a stroke then develop epilepsy. That's why the elderly population is the fastest growing segment, because they're surviving events that historically they may have passed away from. So they have a stroke or they have a brain infection and they survive, but unfortunately they begin having seizures. And if there's also any prenatal disturbance in brain development, there is a small hereditary predisposition to epilepsy, but many times a family has a child diagnosed with epilepsy and they don't know anyone else in their family that has it. So it's not necessarily genetic. So there are many different types of seizures. On the movies, we think of someone falling down and having a convulsion, but there are actually 20 different types of seizures, and they're classified in 2 ways. There are partial seizures where the abnormal electrical activity happens in a small part of your brain, and there are generalized seizures where the electrical activity is happening throughout your brain. And depending on where that electrical activity is occurring determines what type of behavior or sensation the person feels during the seizure. So for example, if the seizure is happening in the part of the brain that controls your visual, your vision, your occipital lobe, you might have, you might black out or have some type of visual hallucination. If it happens on the part of the brain that controls your right arm, you may have a simple partial seizure. Your right arm would move, but you would be able to communicate because your consciousness is maintained. So other types of seizures, your consciousness is lost or impaired. For children, it's really important for teachers and parents to know about these absence seizures, which are seizures that last 5 to 10 seconds and look the exact same as someone daydreaming. They just briefly blank out. The person would continue staring, or if they were in mid-conversation, they would stop and then pick up the conversation right where they left off. And it can happen hundreds of times per day, but it's really important, we emphasize this in the schools, that teachers know to look for that type of behavior because oftentimes it's overlooked as daydreaming or not paying attention. Kids are reprimanded for it, and this whole time they've just been having these absence seizures. And then the final type of seizure are the generalized tonic-clonic seizures that are dramatic to witness, and we mostly think of as seizures, and that is when the body is experiencing a full convulsions. So anyone can have a seizure. As I mentioned, 1 in 10 people will have a seizure in their lifetime. People with epilepsy have what we call a lower seizure threshold. So something that may trigger a seizure in a person with epilepsy would be unlikely to trigger a seizure in someone that doesn't have epilepsy. And the #1 seizure trigger for people with epilepsy is missing their medicine. It's extremely important to remain compliant and to take it as prescribed. Also, any type of stress or anxiety, hormonal changes like puberty or menstrual cycles, dehydration, a lack of sleep or fatigue, any type of drug or alcohol use. That could be an over-the-counter antihistamine, or it could be an illegal narcotic. And then there's a small group of people that are sensitive to lights flickering. So in terms of what you do during a seizure, it's important to know that, again, a seizure is a symptom of epilepsy. And when someone has epilepsy, it is not an emergency when they have seizures. It can be, and we'll address that, but it's really important to know how to react and to not consider it an emergency every time they have a seizure. So the first thing is to try to stay calm, and if you have a watch or a clock around you, to try to begin tracking the time. The longer a seizure goes on, the more potential for negative outcomes. You never want to restrain the person while they're having the seizure. You'll want to, protect their head. If you can place your arm or a blanket or a backpack under their head just so that it's not hitting the ground, that's ideal. Remove any eyeglasses they'd wear, loosen their neckwear. And if you can physically manage to do so, try to turn the person on their side. If you know that they have epilepsy, that should be reassuring because unfortunately some people with epilepsy still have seizures. Understand that they may not be able to talk with you. They may hear you and understand. They might not be able to understand you, but either way it may be difficult for them to communicate. And when the seizure has stopped, try to orient the person to their surroundings. Ask them if they have epilepsy. Let them know where they are, and ask them, what is their name, and just some questions to orient them to their situation. So what you do not want to do during a seizure is you never want to put anything in their mouth. It used to be that you would put a tongue depressor or a wallet because they thought you could swallow your tongue. That is a myth, and you cannot swallow your tongue during a seizure. Unfortunately, some people may bite their tongue, but that is less dangerous than putting a foreign object in their mouth, so never put anything in their mouth. you never want to hold down or restrain the person. The seizure is not going to stop by you holding down the person. What's going to happen is that they are going to, tear a muscle or cause cardiac stress if you hold them down. So just let the seizure run its course. And you never just try to give them more of their seizure medicine. I mentioned that ideally you would be able to roll them on their side. The reason you'd want to do that is that if there's any extra salivation, that it could run out the side of their mouth as opposed to them potentially aspirating on it. So that's the reason to put them on their side. But there are times when a seizure is an emergency. So anytime someone has a seizure and they have not been diagnosed with epilepsy, it would be appropriate to call for help. For those that do have epilepsy and the seizure goes on longer than 5 minutes, or if they begin coming out of the seizure and you're asking them, what's your name, where did you go to school, and then they go back into a seizure, those are what we call cluster seizures, and those can be problematic. So you would want to call, during that. And then if a person is injured or pregnant, the number one concern for seizures, if you have a convulsive seizure where you would fall, is not the seizure itself. It's any type of injury resulting from that. So if you fell and hit your head pretty good, or fell and hurt your shoulder, that type of injury could necessitate, emergency help. If they have diabetes or other medical conditions that, can complicate their situation, if they're recovering slower than normal, or if they're not resuming breathing, it would be appropriate to call. So a slide that I really like and that needs to be emphasized more out in the public is that epilepsy is different for each person. It's a spectrum disorder, and there are people on the uncomplicated epilepsy that 50%, if they take their medicine as prescribed, they're not going to have any seizures. In the middle are the group that sometimes are working, sometimes they're driving, but they take their medicine and maybe have a seizure every month or every 6 weeks or every 2 months, just frequently enough to impact their quality and social life with marriage, etc. And then on the other end of the spectrum are the 30% that are refractory to treatment and continue to have seizures despite taking medicine or trying other treatments. And at the Epilepsy Foundation, we primarily help the people in the middle and the group that are refractory to treatment. So in Northern California, we're very, very lucky. We have 5 pediatric epilepsy centers. You would go to the epilepsy center if your child has been prescribed 2 medicines. If the medicines have not worked and they're continuing to have seizures, instead of going to a pediatric neurologist, it would be ideal to go to a pediatric epileptologist. And just to mention that Kaiser does also have epilepsy specialists. They just don't have a center per se. So if you're a Kaiser patient, you should look within that network about the kids that for the epilepsy specialist. In Northern California, we have several different in-person support groups. Just a few things. A couple of them are teen-oriented, a couple of them are for parents, and the rest of them are just for anyone with a connection to epilepsy. We are active in community education. One of the programs that we promote is the Helping Other People with Epilepsy. This is an attempt to get people with epilepsy or people with a connection to epilepsy to go out in the community, tell their story for 5 minutes, and then provide a training. We have several different approaches. At the top, we train the trainer and they train other people. Training the mentor is us training people with epilepsy to go out into the community. And we've also done this via video conference. We went to Reno, Nevada and trained people throughout the state, and they're continuing on this program. So it's been very effective so far. And then just a few websites that we'd like to mention to you. Again, this is just an overview that these exist. We don't have the time to go into all the detail, but the National Epilepsy Foundation has a fantastic website, efa.org. Get on there, comb around. They have a specific page for Project Access. we worked within California, but as Carrie mentioned, there were 4 other locations throughout the country. We all compile our materials onto the National Epilepsy Foundation webpage, and it's got a lot of great information for parents and providers. So when we were working on our project, one group that was targeted was the rural population, and they were, how can we get support to rural communities? There are thriving communities online. It's called e-communities. It is monitored for accuracy. There are groups for every need you could imagine, teens, moms, men living with epilepsy, and I promise you it's a great resource. At first we were reluctant to mention it because it is not as it's not in person, but it is sometimes it's a good anonymous way to get some questions answered. Another website is called epilepsyandmychild.org. There's some new videos that have recently been posted there. There's also a website called Epilepsy Classroom. In August and January, our call volume is increases, and a lot of it's related to school issues. One thing to consider if you're a parent or a teacher, the use of a seizure action plan, which is a one-page document signed by a parent, their physician, and it could be provided to any school. It says, this is what you do during a seizure, and this is when you need to call for help. And I think Carrie has just put an example of it up on there.
Bill, can you say a couple more words about how we've used this and how families are using it? Because it was one of the areas that we felt was the most critical.
Absolutely. So the reason that we wanted to promote this was there were different target audiences. So we could go to the schools and say, do your students with epilepsy have this document on file? And the schools loved it. Some of them used it, some of them didn't. We could go to the parents and say, does the school use this? Does the sports team use this? And then we could also go to providers and say, have you been filling this out for your kids with epilepsy? So there was different access points we could use to promote this product. And it's been used, it reduces the paperwork that the neurologists have to do because the parent can fill it out and have it approved by the treating physician, or the primary care physician can fill it out and have it rubber stamped by the neurologist. But it's a control document. And
I think the other value that we found in working with families is that it was a good preventive tool. Many families said, my child doesn't have seizures, he's on medications, he's well controlled, but we found that there were times when it wasn't anticipated that the child would have a seizure and the school had nothing to go on, and so they were calling 911 and everybody was upset and there was a lot of chaos. So we really pushed this in terms of just making sure that everybody knows that the child could have a seizure, and it basically says what to do, what the parent and the neurologist's wishes are should that child have a seizure, what's the protocol that needs to be followed.
And at our affiliate, we help families fill that out, so if it needs to be modified, it can be done so, and it's a good program, or good document. And then the last couple slides are related to a teen website, Take Charge Teens. On this website, it was designed by teens. It's made for teens. There's a 12-minute video targeting teens. And the goal of this is to have it presented, the Take Charge program, in anywhere from 5th to 10th grade education. And it just goes over historical figures with epilepsy and tries to demystify some of the untruths about epilepsy. It addresses bullying and ways to respond to a seizure. So if you have any teens, I encourage you to have them visit that site. The next slide is called nomoreseizures.org, and it's really an educational website for doctors, pharmacists, and people with epilepsy to discuss how important it is to make sure when you go to the pharmacy that each time you're getting the same medicine. and to start a conversation with the pharmacist to get to know them so that they know that you have epilepsy and you take prescription A, and each time you come in, you need to get prescription A. And then the last one that I'm going to...
Word about medication substitution.
Sure. So there are people with epilepsy have... the FDA allows a generic medicine to be 20% less or 20% less strong or 25% more strong than the brand name medicine. And when a brand name medicine goes off patent, that means that generic manufacturers can make that same medicine. And a lot of people can use a generic and it saves them a lot of money. Others, when they have been switched from a brand to generic medicine, begin to either have side effects, toxic side effects, like they're getting, the generic is getting, is too strong for them, and so they're feeling dizzy or nauseous, or if the active ingredient is not enough, then they have a breakthrough seizure. And the other challenge is that when a brand name medicine goes off patent, there can be 20 different manufacturers of the generic. So Walgreens in January will buy drug A from manufacturer A, and Walgreens in February will try, drug A from manufacturer B. And so people are getting different doses of generic medicines. So it's not as if brand name is good and generic is bad. It is knowing that when you go to the pharmacy, you need to make sure that you're getting the same generic every single time. Or when you go to the pharmacy, the pharmacist needs to tell you that the insurance company has denied the brand name drug and that now you're receiving a generic. Again, for a lot of people it works fine, but we believe that patients should be informed so that they know to look for these side effects if their medicines are being changed. If you go in for a toothache and it's a painkiller, that's not that big of a deal. If you're talking about someone that's been on an epilepsy medicine for 15 years, taking the same medicine, and all of a sudden they get a different medicine, that could result in a breakthrough seizure for them. And again, if there are questions at the end, we can happy to answer those. The last thing is that there are nearly all of the resources we discussed today available in Spanish. There is a national website called Fundación para la Epilepsia, and a lot of the project access resources that we have developed have been translated into Spanish and are on the EFNC homepage that we'll show you later today. So I know that was a ton of information, but hopefully it was helpful, and I'm happy to answer questions towards the end.
Great, thanks, Bill. The other website that I wanted to mention, and we have, there are many national organizations that are working to make materials and information available for parents and professionals in the area of epilepsy and seizure disorders. And one of the sites that we have also worked with is epilepsy.com, and they too have online support that they offer. They have lots of resources for not only parents but also professionals. It's a very well-visited site. They've got a number of neurologists that oversee everything that goes onto their website, and it too is a really good resource for you to look at or for you to share with families or providers that you're working with. So let me talk a little bit about some of the print materials that we've put together and what they include. And this is a list of what we've developed. We had a lot of help from family resource centers throughout California in the development of the Parent Resource Guide in our first grant. And we have made some changes over the years to that. And we're really excited to say that we have also translated it into 3 other languages, Spanish, Chinese, and Farsi. And they're not an exact translation of the English Parent Guide. In all of these, we worked with parents and neurologists to look at what was the most important content to cover and to be culturally sensitive to words that are used in other languages in terms of talking about epilepsy or seizures. And so the Chinese and Farsi guides are a little bit different. They are set up for a national audience, so you will not see as much California-specific information in those versions as you will in the English and Spanish. And we recognize that there was a need across the country for those other languages. The Parent Resource Guide is available in print. It's available as a PDF that you can print out, a parent can print out. It's close to 35, 40 pages long, and at the end of the parent guides, we've included a seizure action plan. We've included tips for notes-taking. We've included a page that identifies tips for talking with your doctor. We have included a form where the parent can write down key contacts. They can write down and track medications their child is taking. And in the most recent English Parent Resource Guide, we actually have tear-out pages for that for the parent to be able to use. And in the PDF version, they can print those pages if they want a copy. We encourage you to share that with families. We've had a number of neurologists that are using this parent guide with all families that come into their program and giving copies to parents, which we're really excited about. The next one listed, the preschool guide. We worked with Marie Polson, who is a psychologist here in our USED and sits on the state ICC and has a number of years of experience in early childhood. And we felt that there was a need for helping at the preschool level, helping teachers to better understand how to work with families and include the child in the classroom, help people feel at ease if the child were to have a seizure, and just really tips for the classroom teacher. All of these materials are available on the website as a PDF and can be printed and shared, and we can print copies from our office here also. The California Policy Brief, we, at the beginning of the grant, were asked to do, by HRSA, were asked to do a pretty thorough needs assessment in each of our states to determine what were the barriers that families and providers face in providing good access to services. And we took that information and put policy briefs together in each of our 4 states to be used as a talking tool. The state of Nevada, through their Partners in Policymaking program, actually used their policy brief, equipped parents and individuals with epilepsy with the policy brief when they went to the state capitol and visited policymakers as a way of being able to talk about what the issues are in the state. That also is available on the website, and we would welcome your participation in using that as you talk with policymakers about the barriers that we face in California. The next product that's listed there is the medication substitution. It's a one-page information or a fact sheet that talks about what Bill discussed earlier, and that is helping parents to understand how their child's medications could be switched and what their rights are in terms of making sure that they understand that process and know how to talk with either their pharmacy or their provider about medication substitution. The last one listed there, the seizure description tool, we developed that in the first epilepsy grant, and we were working with a neurologist at Children's Hospital Orange County who had asked us to come up with a form that she could use in working with families whose language was Vietnamese. And she felt that it was so helpful for families to be able to describe to her what the child's seizure looked like, what happened when the child had a seizure, because it helped her to really be able to make a definitive diagnosis, as Bill talked with you about the different types of seizures, understanding what happens when a child has a seizure and being able to describe that to a neurologist or to a physician is really helpful. And we developed that tool originally in Vietnamese and English, and since that time we have translated it into several other languages, Spanish, Chinese, and Farsi. And not only have we seen providers using that tool, we've also seen parents use that tool in helping a classroom teacher or a preschool teacher understand what might happen should the child have a seizure at school or in the classroom, what they should expect. So we've used that tool quite a bit. All of these materials and resources we have posted on Epilepsy Foundation Northern California website, and many of them are also available through the National Epilepsy Foundation website. I'm going to tell you a little bit about some audio files that we have put together. I'll come back to this in a minute. And we worked with a nonprofit group in California to develop these audios. When we come back, I'll tell you a little bit more about those when we get to that slide. So some of the different training strategies that we've used in California, again trying to look at rural and frontier, is how can we get information to parents and providers when they live pretty far away from urban areas and big cities. We've had a number of teleconference calls, video teleconference that we've done. The podcast I'll tell you about in a minute. We've posted a lot of materials on web pages, and we spent a fair amount of time over the last year trying to do outreach to local media through newspaper and radio. And what was interesting about our outreach to both of those groups is we were foreigners to people in rural areas, and they were a little bit hesitant to publish and to put radio public service announcements on the radio because we weren't local. And one of the lessons that we learned is the message is received much better if it is somebody in that rural community that is delivering the message. So we have developed and have available for anybody interested. We have written newspaper articles. We've written radio public service announcements that can be hosted on the local radio station. And in both of those, it's a matter of contacting the media source, giving them the script, and asking them if they will either have someone read it or publish it in the paper. The other strategy that we worked on with libraries, we tried to get the parent resource guide into the local library so that as families are looking for resources, maybe they can find the parent resource guide in the library. The challenge that we came across with that is most libraries want bound copies like you would find in a hardcover book because they hold up better in the local library. But libraries were a resource in terms of making information available. And as I mentioned earlier, many of our materials, we have worked very hard to make them available in other languages, and for assuring high quality and also being conscientious of literacy and the nuances of how words are spoken in other languages. We always had reviewers that spoke those languages review our materials, parents and also professionals, to make sure that we captured the right language. So Smarter Medical Care is a group in California. It's run by a physician who is retired and is doing this as a service to the community, and he has lots of podcasts that he has developed in helping consumers to be better advocates for their own or their family's care. And we partnered with him to develop these short podcasts about epilepsy. We have them in English and Spanish. Actually, we have several in English and several in Spanish. And we carefully selected the neurologist that we wanted to work with, who is interviewed by the producer, Dr. Radvian, and it's David King Stevens, who is a neurologist in San Francisco, is the person who's being interviewed, and Spanish is his native language. What we found from talking to families is they wanted these podcasts easy to access, and we have since downloaded them onto a CD that actually can be played on your car stereo or in your car CD player, so that if you wanted to listen to them while you were driving or you had a boom box at home, it's something that you could actually listen to. And I'm just going to play, I'm just going to do a quick audio of this first introduction.
Smarter Medical Care is a non-profit organization dedicated to relieving the anxiety of patients. Please consult your physician for medical advice.
The first step toward getting the best possible medical care is being informed. Hi, I'm Dr. Robin Rodvian, and welcome to the Smarter Medical Care series of podcasts. Our goal is to empower patients, their family members, and friends by providing clear, compassionate conversation with medical experts. Today, we will discuss selected issues about epilepsy. Epilepsy is another name for recurrent, unprovoked seizures. By unprovoked, most physicians would mean there is no identifiable cause of the seizure, such as a very low blood sugar or knowledge that a person has cancer that has spread to the brain, or any number of other events.
So that's just a brief snippet. Dr. Radvian's podcasts are, we've got a link on our website, on EFNC's website, and we also do have those that can be burnt onto a CD for car or home use. So let us know if that's something that you're interested in. The other podcast, or actually a radio public service announcement that I wanted to share with you, and again, this is one of our lessons learned. We were trying to reach out to the Spanish-speaking community, and in Southern California, Piolín is a morning talk show, and we contacted the radio station, gave them the script that we wanted read, and they actually asked Piolín, which is Tweety Bird in English, they asked him to actually read this online, and our goal was to get listeners to call Epilepsy Foundation Northern California to get a copy of the Parent Resource Guide, and I'll just quickly play his public service announcement. It ran a number of times, and there were quite a few calls that went into EFNC requesting copies of Parent Resource Guide.
Si tu niño o algún miembro de tu familia tiene convulsiones o epilepsia, hay guía de recursos gratis para todos ustedes. Para recibir gratis una copia de esta guía, llama a la Fundación para la Epilepsia del Norte de California a la línea gratuita 1-800-632-3532. 1-800-632-3532. O visite la página de internet www.epilepsynorcal.org.
So that was one way for us to reach out in some of these more rural areas, especially families that are really difficult to reach, and we did get a response from that. It did not cost us a penny. We had the script that we put together. We contacted the radio station. We asked if it could be aired, and they said that they would be happy to do that.
That was very exciting when it happened, and as Carrie mentioned, we did receive several calls in Spanish. That was awesome. That Piolín reaches a huge audience. So just a minute, I just wanted to go over the Northern California website, and it's specific to Project Access. So I think you can see it on the screen, but if you go to epilepsynorcal.org, on the far right, there on one of the red tabs, there are resources, and if you click on resources, one of the options is Project Access. And it has a description of our program, or of the project, and and then it has all of the resources that we've developed. So this is the page that gets the most page views on our website, and it's got a lot of great resources out there for you. So I encourage you to visit there. If you notice at the very top, we have a tab for En Español. We have one for Farsi. We have a Chinese logo. And if you do get on the website, if you have, specifically for the parent guide, but for any of the resources, if you have any suggestions, please let us know. When we did this project, we viewed the Project Access webpage as one of the sustainability components, and also the parent guide. It's fantastic. I mean, if a parent has a newly diagnosed child and they get this parent guide, they are going to be much, much better off than had they not received it. And we want to continuously adopt it and change it. And so if you read through it and you have suggestions, please email us, because the parent guide is going to continue on, and we'll edit it every couple of years. There's also information about your rights, your legal rights for in the school system. There are the seizure description tools, which are visual, and you can click on those in the different languages that Carrie's already mentioned. And there's a lot of different brochures that are specific to children and youth as well.
Okay, I don't know why Tara, I can't go forward. For some reason my slide is...
Are you stuck?
Yeah. Let me see. I wonder if...
Do you have an arrow, maybe? An arrow button on your keyboard you could try?
Yeah, I'm trying that too. I was trying to a little bar so that people could see the full website. I think I'm frozen now. Sorry. All right, let me just do that.
Okay. There you go.
There we go. So let me just mention a little bit about social media networks. All of our states actually tried to look at setting up resources in these areas. And again, it goes back to some of the rural challenges. In the state of Wyoming, our group there worked really hard to set up Facebook contacts and seemed to have really good participation because of the rural nature of the state. And a group that we worked with in the state of Colorado also had a social network that they set up using social media networks. And I know the National Epilepsy Foundation has really tried to look at getting more resources on YouTube available to families. So there's a lot of activity in that area. The other resource that we came across, the National Epilepsy Foundation has a lot of great materials that we contacted them and asked if we could do adaptations. And one that I want to show you is the Wyoming Epilepsy Group took a snippet of, worked with a local TV station and was able to take a snip out of National Epilepsy Foundation video and post it on TV as a public service announcement. Again, trying to, oops, let me go back, trying to gain contact with people in the state.
We come in all shapes and sizes.
We do what everybody else does. I'm just like you. You know what's totally messed up?
What's that?
When people judge other people. It really hurts if somebody judges you because you have epilepsy.
Oh, the whole class just ganged up on me and I just started laughing.
To learn more about epilepsy, contact Wyoming Epilepsy Association or Wyoming Neurologic Associates.
So that also cost them very little, very, very little money. They asked that it be done as a nonprofit, as something for the community, and they actually had lots and lots of follow-up phone calls from parents that were looking for resources. So we've talked a lot about materials that are available through our webpage. Let me just mention to you about an order form that will be posted for you to access. And we are happy to send you first copy free for any of the materials that we've talked about today. So I would encourage you to print out this order form. Please order away. We don't have funds to make unlimited copies of materials, and which is why we've created many of these materials as PDFs so that you can either send them out to folks as a PDF or even print copies yourself of these materials. So please feel free to send this order request form in to us. And that was what we had to cover today, and we'd be happy to answer questions.
Great, thanks. So again, if you're calling in by phone, you can go ahead and do the little hand icon to let us know that you want to be unmuted. And if you're using a microphone with a headset, you can also do that. If you're just listening to the presentation by your speakers on your computer, you'll need to type it in. So please feel free to ask questions at this time. And while we're waiting for folks to type in, I have one. What's next for this project?
We have a few months remaining. We're trying, our strategy now is to really try and disseminate these materials. Other grant opportunities to be able to continue what we've been doing. Certainly the Epilepsy Foundation affiliate of Northern California is available, an incredible resource, have volunteers. Their territory goes from Fresno-ish all the way up to the Oregon border. They do have individuals available that can help with doing outreach training. They're available to do any other form of training, whether it's a teleconference training. What we have encouraged individuals to do, and if you don't know, anything that is produced with federal dollars, it does not have a copyright. Any of these materials that you are wanting to use or adapt or add to or edit or expand on, we are thrilled to work with you, thrilled to help you put your brand on it so that you can share it with others. The focus of the project was really about looking at improving access to care, and we certainly here in the USAID will continue to work towards improving access to care for children with special health care needs and their families, and certainly work with the Epilepsy Foundation in any way we can.
I agree. I think our primary goal is to try to connect with more families affected by epilepsy so that they can obtain these resources. And very early on, we've been partnering with the epilepsy centers, and there's a Kaiser neurology clinic that is promoting these materials, and it just is so, you know, for the families that have gotten, for example, the resource guide soon after diagnosis, it has just made navigating the health and human services available to them much, much easier. And we're going to continue to add to the website and adapt the materials as we learn, you know, what families need and, you know, what we can take out of there.
Great, thanks. Okay, we have a question from Ajay. I'm going to unmute you. Are you there? Ajay?
Yeah, can you hear me?
Yes, we can hear you.
Okay. First off, thank you so much for putting this together. My daughter is 7 years old and was recently diagnosed, and I am losing medical coverage due to a job loss. So I guess I was curious if you guys have resources, or, and this may be something that I call in and talk to somebody, but are there resources specifically set up for her? And if, you know, obviously I'm going to try to find health coverage, but it's going to be difficult. So I guess I'm asking, is there anything that you guys might direct me to look at for financial assistance or whatever that she might need?
This is Bill, and yes, we receive these calls a whole lot, especially with the economic downturn. There were a lot of families that lost their health coverage, and that would be better discussed over the phone individually. But in short, It kind of depends on how frequently she's having seizures, because that will determine what state services she's eligible for, whether or not it's regional center services or CCS, California Children's Services. So those are, at the minimum, she should be eligible for the Children's Health Insurance Program. She may be eligible for 2 additional programs, the Regional Center and CCS, which would cover even more costs in testing, and we can discuss that anytime. Our phone number is 925-224-7760, and I'm not sure, Carrie, if you have any other. So.
No, I think that was great, Bill.
Okay.
And my other advice, too, this is Tara just piping in, that you could also contact your local Family Resource Center, and they can help with that as well. And if you need help finding your local one, just let me know, and I can get you connected with them.
Perfect. Well, thank you again.
Thank you. We have one type-in question from Jennifer. Jennifer says, you mentioned support groups. I live in Santa Barbara, and I'm unaware of any support group. How do I find out where my local one is or how one can be created?
Okay, well, thanks, Jennifer. You live in the part of California that officially is not part of any of the service territories. So we represent from Fresno north to the Oregon border. The Los Angeles affiliate is Los Angeles, San Bernardino, Riverside, and Orange counties. And there's an area of the Central Coast that is not covered. And unfortunately, to my knowledge, there's not an in-person support group. We do get calls from there, and we're happy to provide any type of resources like a facilitator startup kit and advice in terms of how to organize a group. The best thing in the meantime would probably to utilize e-communities. I know that it's not in person, but it has a lot of excellent advice. And the other program would be Epilepsy Connection within the Northern California affiliate. You know, even though it's not, Santa Barbara isn't part of our service territory, we'd be happy to try to connect someone in a similar circumstance with you over the phone. But I'm not aware of any local support group there.
Bill, it's Carrie. I would say to contact the Family Resource Center in Santa Barbara, and the director of that FRC, I bet, would know if there was anything in the community that is currently organized.
Yeah,
good idea.
And then, Bill, if somebody wanted to get involved, is this something that you all would be able to help with some of the programs you offer to get her set up?
Yes.
As an advocate or a support?
Yes, we have a facilitator binder that we send to interested facilitators that details the expectations, the roles, and ideas to how to start it up. And then we could also serve as, you know, troubleshooting if she's having trouble getting access to a space. We always try to get it in an area that's publicly accessible or public transit accessible. And oftentimes hospitals have a ton of rooms available for free. So we could talk about, you know, ways that we could help you market it, and then any ongoing consultations. So Jennifer, if you want to call us, again, the phone number is 925-224-7760.
Great. Thank you, guys. Well, it looks like we're out of time, but I want to thank you so much for presenting today. This was such a great presentation.
Right, and I would encourage people to get in touch with either myself or Bill. We're happy to follow up with you. If there's ideas, strategies, things we can help with, please let us know.
Great. Thank you both. To everybody who joined, thank you. You'll be receiving a follow-up survey by email. Please take the time to complete it for us. If you're not already on our listserv and want to know about upcoming webinars, please go ahead and join. You can find that information on our website. Next month's webinar will be on Wednesday, February 2nd and it's going to be on healthcare reform with DC-based Family Voices policy gurus Janice and Brooke, and I hope everybody will join us. And thanks again to our presenters. This is wonderful.
Thank you.
Goodbye.